Members of the Cameroon Young Juries Legal Resource Center (JUJLEG) are having fruitful exchanges with stakeholders from the judiciary and the health workers of the Southwest region in this one-day knowledge acquisition seminar on gender-based violence.
JUJLEG came up with this project because after over 6 years hostilities and armed crises in the Northwest and Southwest, and of course the over 11 years armed crisis, Boko Haram crisis in the far north, Cameroon has been plagued with a lot of adolescent pregnancies since the girls were all out of school for over 6 years, and unwanted pregnancies by women who were caught up in this crisis. So JUJLEG thought that the only way to be able to help the women out with regards to their reproductive health rights was to bring the actors together, the doctors, the prosecutors, the judges, the investigators, and the social workers and civil society who are women advocates, to be able to come together and think about applying the law on abortion, which warrants that when women have pregnancies or young girls have pregnancies out of rape, they are entitled to safe abortion. Most women don't know this. The population does not know this, and so JUJLEG thought that it's high time we start echoing this. Abortion is not illegal in Cameroon. Abortion is restricted in Cameroon. Safe abortion is provided by the laws, by the penal code of Cameroon. But most people don't know this. But thanks to our founders, SAF, Safe Abortion Action Fund, we are able to kickstart this campaign on the right to the safe abortion provided by law in Cameroon. It is high time we started echoing this to the community, echoing this to the women, so that they stop dying, so that they stop resorting to unsafe abortion, they stop resorting to uncouth means of terminating unwanted pregnancies, because the law is there for them. We hope we can do this for long, of course, with the support of our funders, the Safe Abortion Action.
Social impacts that survivors of gender-based violence, whom according to the United Nations report of 2022 says that 70% of survivors of this act are mostly women and girls, and as such, the health experts on their part reiterate on the pivotal role that they exercise.
To render justice for the time of justice, as they say, the impacts on the health of these survivors of gender-based violence. That is why it's very significant for these two calls, the medical, the legal, to come together and have a midpoint, a compromise on how to hasten the judgment of these survivors.
To one of the judges of Cameroon Supreme Court, Justice Vera Kwete Ngasa, hammers on the negative impacts involved in this nefarious act and call on collective efforts to combat this.
Specific. We're talking about gender-based violence, but in this context, it's conflict-related gender-based violence. We all know what has been plaguing the Northwest and the Southwest this past 5 or 6 years. And sexual and gender-based violence in time of war is not new to Cameroon.
The forces of law and order, on the other hand, say they are leaving no stone unturned as they reiterate on the different technicalities in the society.
These conditions that at least victims can be taken care of, and first of all, the preventive measures that the police do to prevent the acts of violence, gender, and if that happens, there are measures, there are ways of taking care of victims.
As the curtains drop on this one-day workshop on gender-based violence by CJLEC, collective efforts and engagement have been taken by the justice system, the health department, and the forces of law and order in the country to eradicate this nefarious ill from the southwest region and the Cameroonian society at large.